Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the ankle. It is the anterior drawer test for the ankle. Now the origins of this test are kind of lost because the papers that reference it or talk about it come from the early 30s and the late 40s. So this was talked about back then, and they reference that this test is a good one to look at the integrity of the ATFL and to assess for lateral ankle instability, which we're going to show you right now. To perform this test, you have the person lying on their back or just sitting on the table with their foot off the table. What you want to do, you can hold the calcaneus and you want the foot plantar flex to about 20 degrees. Stabilize the tib fib, and you can either do one of two methods, and there's different authors have said different things. One, you can either pull the calcaneus forward, so I'm pulling it up this way, or I can use this other hand and provide a posterior force to the tib fib, right there. And we're looking for movement here. So are we getting a lot of movement? You can grade it. There's a couple different grading systems, or production of pain, or, you know, like dimpling as they call it, because if you get that tear, you'll get that little dimple right there. Now you may be wondering, how much force exactly do you use? Well, some people looked at that. They looked at different amounts of forces. So they looked at 10, 20, 30, and 40 newtons, along with 60 newtons. And if you're wondering how much a newton is, it's not the cookie. It's about 0.2 pounds. And they found that at about 30 newtons, or 6 pounds, roughly 6 pounds, was more sensitive than 60 newtons, which is almost 13 pounds. So I've got 15 pounds here. So that's all you have to do. You just got to put about 6 pounds of force through that to produce very good results with this test. So for the research on this test, there's actually a lot out there. But recently they did do a large meta-analysis to look and to determine on, is this still a good test to do? And they came to several conclusions from looking at all this evidence. One, that they found that the interrelated reliability is better the more experience that you have. So again, more testing, you're going to be able to diagnose better. Additionally, they found that the sensitivity is higher, is a good sensitivity with an acute injury versus a more chronic. And that kind of makes sense because you kind of lost the integrity there with an acute injury versus that chronic, you have scarring and healing and all of that has gone on. And they also talk about the grading system, that they said, if you make it a little bit expanded out a little bit more, it makes it a little bit better. So overall, they said, if you really want to improve this test, you have to standardize a lot of things with it to just, make sure that you're just getting consistent results. So there you go. That is the anterior drawer test for the ankle. What do you think of it? Do you still use it? Do you like it? Is it your go-to for ankles, or what have you found about it? Let us know down in the comments below. And as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.